Further ado, I will let the ladies introduce themselves and talk about Renfrew Educational Services. Thank you.
Hello. So we're with the Renfrew Educational Services team. My name is Alexa, and this is Liza. We'll jump into it. So today we're gonna go over our program, talk about what we do, talk a little bit about brain development and how that connects to our services, go over the services we provide, a little meet the team, to go over everyone in the team and the referral process. So a summary of our program: the Renfrew Stony Health Allied Health Team, that is the word health too many times, offers culturally safe allied health services to support a client's physical, behavioral, cognitive, and language development. The team works closely with families to build trust, consultation with families, and incorporating family strengths into services. And the services we provide lay the foundation for non-judgmental support to children, youth, and young adults up to the age of 18 years old. Cultural safety is an ongoing process. We must continually revisit our own knowledge, attitudes, behaviors, and processes to better meet the needs of the community in a non-discriminatory way that respects the culture and supports participation and decision-making for care.
I wonder if we should talk about what Renfrew actually is too.
I guess I'll give you a broader Renfrew as a whole. So Renfrew is based in Calgary and has 3 schools: Janice McTighe Center, Thomas Bouchard, and Thomas Buchanan, and the Child Development Center. And these, and the Boness, there's a location. So these schools and programs support children into elementary age who have cognitive and functional differences. So in those classrooms in the city, they'll have like a teacher, and they, similar to our team structure, they have therapists on site, like psychologists, occupational therapists, physiotherapists, speech language pathologists. I forget.
Are those the schools run by Renfrew?
Yes.
Okay.
Yeah. Yes.
And is there a fee for those schools, or is it public funded?
So most of the funding for the Renfrew schools comes from applications, I think, to the government. So most of the kids are tough funded. So typically when they're get the assessment done or a diagnosis, then they can apply for money to help support that as well.
And there's a lot of fundraising that happens too.
Yeah, Renfrew is technically a non-profit organization. In the community in Calgary as well, there is therapists who are contracted out to schools, so they also can serve kids who aren't in a Renfrew school but need a psychoeducational assessment or speech. I think those are kind of the main ones.
Just all the public schools.
Yeah. Anything else about Renfrew?
Yeah, actually in Canada as well.
Yeah, and we also have teams. A team in Bighorn, Eden Valley, Sutina. Is that any out there?
I think that's it.
Yeah.
Yeah, Renfrew's also big high school students.
Yeah, which is kind of a cool thing. Renfrew, over the past year, they've did a lot of fundraising. So it's going to be a new school called the Legacy School, which is opening up in Bearspaw area, which will be supporting, I think, junior high all the way up through high school, which is really cool. So when that opens, kids now from continuing from any of the centers that Alexa talked about will be able to go to the high school and continue to receive those supports.
Yeah, that'd be great, because a lot of times it's can be a gap in services. Sorry?
Does that gap from 9, 10, 11?
Yeah, that's what I was gonna say. Yeah, right. Puff funding when you're younger. So it will fill a gap.
So Renfrew has, they have that big program, and then we are part of the First Nations program, which is contracted out to the First Nations Health Services teams. So we're just a small part of Renfrew. And our service delivery here at the clinic is quite different from what most of Renfrew is. Most of it's school-based stuff.
Yeah.
But that's where the name comes from, Renfrew Education Services, because they're actually a school-based company in the first place. I wanted to talk a little bit about brain development, because the basis of a lot of the stuff that we do is helping children and families basically learn in different ways, and trying to help that early years development as well, just to give these kids and these families the best chance possible, right? So in the first few years of someone's life, their brains are quickly growing. So there are all sorts of neural connections that are happening within the brain, and we're building neurons until we get up to about 3 years old. And then we end up sort of pruning these pathways, and then our brains become more refined, and we end up using the pathways that get used more become stronger. But basically, during this early development phase, the more input the brain would have, the more different kinds of connections can be made, right? So sensory input, visual, emotional input, like any sort of experience that the child has helps develop their brain. And anything that's happening in those early years really defines what the structure of the brain will be going forward. So part of our programming is to try to help these kids like grow a really strong foundation for their brain health too, and just to give them the best chance moving forward. So you can think of it, I'm kind of pulling a lot from Brain Story. I don't know if anybody has done Brain Story in this room, but I love it. But basically you think of a brain as like it needs to be built on a strong foundation. So it's this foundation that we're thinking about in these early years to build a strong foundation so that house can be built nicely, basically. Yeah, so then I guess also the better the brain architecture, there's improved learning capability, improved behavior, physical and mental health function. All those things work best when we have nice, strong brains. So the question is, how do these strong brains get built? And basically in the first few years too, the children are really relying on their community and their family and their environment to have positive experiences in order to reinforce these good pathways. There's something that Brain Story refers to as serve and return, which is basically the little conversation you might have with the baby when they're smiling at you and you smile back, even a nonverbal conversation, eye contact, responding to a child if they're asking for help. All those things are positive interactions that are help building the brains of these children. And the brain is actually changing structurally. So it's interesting to think of it as a physical thing that is being formed in those early years. The structure of the brain, like the physical structure of the brain, is dependent on these environmental experiences. Support for families is a really important thing, right? Because if the family feels like they have support, then maybe there's a little bit of extra energy or less of a feeling of stress, and they have a little bit more to give to their children, a little bit more time. So that is also our role. So sometimes families come and they're having difficulty with a child's behavior, for example, or toileting issues or something, and they need some help within the home because that's causing stress. We try to provide some strategies to help the family, like create some space around that so it can be a little bit easier. I want to talk a little bit about stress because our brains are heavily influenced by stress. And there's 3 different kinds of stress that we think about. So positive stress would be a kid's first day of school. So they're going to the school, it's stressful, their brain is kind of in high alert, but there is a positive outcome from it. They have support, someone's there saying, go ahead, you're gonna be great. A tolerable stress is something that might happen within a child's life that is stressful for them. What's that?
COVID-19 is a big one that everyone.
Yeah.
Toxic stress.
Yeah, it's gonna be kind of overarching.
Yeah, so something that's maybe a little bit bigger. There is an adult that can give them a little bit of support and feedback through that, but it's something that has impacted them a little bit more. And toxic stress is something that has really had a really big impact on the child. It's typically something that nobody can take away from them. So it might be growing up in a country that's at war, or having a family situation where there's violence in the home. Like things like that are harder stress to deal with for the kid. Pardon?
So food insecurity.
Food insecurity, yeah. And so there is research showing that supporting families to help reinforce these like tolerable stress situations and positive stress situations, it really helps build stronger brains in these kiddos. Any questions so far? Kind of babbling on? No? Okay. And so I also pulled this little thing. Oh, it's not. Oh, it is playing. This is also from the Brain Story website. So, and this is a really interesting model to think about, like how our brains work and how having community support and our own internal support systems, like knowing how to deal with things, really helps us deal with situations in the future. It's a lot to look at, but so this is a basic teeter-totter with the fulcrum in the middle. Negative experiences, we can think of it as those red blocks. These are positive things. We have good food, we have happiness. But if the fulcrum's in the middle, it will be equally weighted by negative and positive experiences, right? But if someone has a lot of negative experiences in their life, a great thing to do is to be able to move the fulcrum that way so that the positive experiences have more impact. And what moves it this way is us, right? It's the community, it's teachers, it's healthcare services, it's building those strong families so that a child can be resilient. It's the child's having their own strategies as well to be able to deal with these stressful situations. So this is kind of so along with getting positive support, a lot of this sort of early childhood therapies that we have, like we aim at trying to build resilience to it in the kids and the families. And that's moving that forward in that way. Does that make sense? Yes?
We always need to dive in.
Okay.
Okay, well, we'll talk a little bit about how we, our therapy sessions work, or intervention sessions. Renfrew conducts use play-based therapy. We use play-based activities to address developmental, emotional, social, and behavioral challenges children might face. This approach recognizes that play is the primary way children learn and communicate, making it an effective tool for therapy. Parents and caregivers are often involved in our therapy sessions, so therapists may teach parents strategies for supporting their child's development through play at home, strengthening the parent-child bond, and promoting continued progress outside of therapy. The services that Renfrew provides are broken down into individual therapy disciplines. So yeah, you can see little pictures of us and some of the, yeah. So a lot of our sessions look like just playing, but obviously there's a lot more going into it. Yeah. So where to find us? So our offices, be really impressed. We are doing Jeopardy at the end. So the more minute details you can remember, the more prizes you can win. So our offices are located at the west end of the health center, so just out here, near the staff lunchroom. Room 162 is our speech therapy, occupational therapist, and our speech therapy assistant all are in that office, and psychology and family support, myself, are in 163, and Liza is in 168. And then our therapy rooms are 160 and 169. So 160 is kind of our bigger therapy room, usually used for, 160 is our smaller one, usually used for older children assessments. And then 169 is like the bigger one where we kind of have for younger children and have a more bigger fun play area.
Yeah, if we have like more movement stuff going on, the kid needs to jump and spin and
and I'm sure
things like that.
Like most of you guys with families, sometimes there's like a lot of people, right, who come, a lot of different individuals, not just parents, right, who come to support kiddos. So if there's a lot of people, we'll even move into a cultural room to get some more space. So I'm just going to go through and introduce our team members. We also have, I'll hand them out maybe at the end, like a handout with all our faces, names and emails and phone numbers, just for like quick reference for the future. So our speech and language pathology team, we have Shabnam, who is our speech language pathologist, and Erica, who is our speech language assistant. Speech therapy, they focus on expressive vocabulary, following directions, using sentences to communicate, augmentative communication. That's using different methods to communicate, like corkboards, iPads, pictures that kids can point to, stuttering, speech sounds, and speech clarity as well. And their services are available Monday, Tuesday, Wednesday, and Friday.
And I didn't really know before. Most of my career has been with adults, and before working with kids, I didn't really understand like all the full services of an SLP or of language, basically all the different parts of it. So it's like children might have difficulty understanding what you're saying. They might have trouble understanding what a sentence means. They might know what the individual words are, but they don't understand the context and the meaning of the sentence. They might understand everything, but they can't actually say the right words that they want to be able to say to express themselves.
So it's not just about
It's not just about like, do you have a list, you know? Yeah, it's not just speech sounds and like motor skills in the mouth, but it's actually like the brain's ability to understand and use language as well, which is really interesting.
Yeah.
Because sometimes you might be talking to a kid and you're like, why are they ignoring me? You know, but they actually don't really understand what you're trying to say. And kids learn really quickly, we all know, when they develop coping strategies. And so sometimes it's hard to tell what they can and cannot understand. So Shabnam and Eric are really good at deciphering those things. This is me. A lot of my referrals at the health center actually come from the nurses here and from the physicians. I see anybody from infants up to 18-year-olds, technically. With the little babies, I often I see them for like stiff necks, or if they have a little flat spot on their head, or if we're noticing that their gross motor skills aren't quite meeting what the expectations would be. Sometimes I kind of ask myself, like, why are these milestones important? You know, because your child should be doing this by this age and this age. But basically, we have these guidelines with milestones just so we can catch things early if they happen to be a problem. So most of the time I see a kid and they're just a little bit behind at doing whatever, and it's okay for them. It's their own path, right? Everyone has their own path. But our services are here to support families with that if they have a concern, and just to make sure that things are still moving in the right direction, right? And so with older kids too, I see like the regular old sprained ankles and hurt shoulders, and maybe if someone's had a surgery or a fracture or something, then I help them recover from that as well. And I sometimes also see adults if Katie's caseload is getting really big. So yeah.
I feel like we have a question on about that one if you want to go for what plagiocephaly is.
Oh, well, I talked about the flat spot on the head. That's something called plagiocephaly. So, yes, that's what that is. There might be a quiz question about that.
Yeah, I was like,
Okay.
okay, I took that.
That means flat spot.
That's an often
Yeah.
that you get referred to
Yes.
often.
So this is Andrea. She is our occupational therapist. The OT's job is quite broad as well. So she deals with, she might get referrals for fine motor skills. You think of that as OT, like your ability to use your pencil correctly and do those sorts of things and getting dressed. But it's also emotional regulation, someone's ability to deal with sensory input. So giving family strategies and these individual strategies to be able to, I guess, like cope or deal with different situations that they might be in that might be giving them increased anxiety or something, or difficulty just participating. She also actually does, like for some small babies, she's learning a lot about feeding. So there's been some kiddos too that need some help with transitioning from bottle to solids and stuff. And so she's been doing some stuff like that as well, which is really interesting.
Can I talk about you? Alicia. So Alicia's our psychologist, and I feel weird talking about you with you here, but if you want to add anything, so she offers counseling and play-based therapy support, support kids and families' overall well-being. You work with grief and loss, trauma, anxiety, depression. A big piece is also the assessment services. And assessment services covers mental health, cognitive functioning, psychoeducational assessments. Those are all different types of assessments that she can support with. And that's for children and youth. And yeah, she's great and in high demand. And our team always, we also have there's a Renfrew team at the school we'll talk more about later, but especially those psychoeducational assessments, those are really like a lot of kids. Yeah, expensive. So we're like having her out here able to do psych assessments, and same the Renfrew psychologists who can do psych assessments. It's like really, really important and really great for the kiddos who need some extra support, and just, it's a lot of money in the city, so it's really great to have her services here.
You can do that.
Yeah.
Because
Yeah.
we just paid over 4,000 last 8 months.
Wow.
I love here too. I just got her assessment 8 weeks ago. I'm doing my reassessment for my kid this year.
Yeah, so we kind of say, maybe it doesn't. We kind of say it's kind of like a rainbow service out here to be able to have that. So it's really
And
great.
she can correct me if I'm wrong, but another question might be like, why is assessment and diagnosis important? but sometimes to access funding for families,
Yeah.
like you can get a lot of funding from the province for extra supports, and to access that funding, having a diagnosis is sometimes a critical step. So providing these assessments can result in diagnosis, which opens the door for families to get more help.
Yeah. Also just
It tells you what toolbox to use.
Exactly, yeah, and that time,
Yeah.
yeah.
and
Through.
okay.
Just a little bit.
Okay, and myself, I'm the family support worker. So I'm a social worker. Bit of everything. I don't know. Yeah, so I provide like brief counseling, resource support for caregivers and their children, connection with outside resources, like a lot of Jordan's principal, referrals to other agencies on reserve here and off reserve. Yeah, like a lot of my work is with the caregivers or parents of the children receiving services. So I don't do one-on-one intervention with kiddos as much, but obviously, yeah, a lot of Jordan's principal, a lot of FSCD, family support for children with disability applications, which again, once a kiddo can get that diagnosis, that's another pathway for more support services.
And basically, I think it's really nice to have Alexa. We used to have a family support worker, but she was only here once a week. And Alexa's here 3 days a week, right?
Yes.
And
It's
it's been so nice to have her because, as a physio, I mean, I can understand the social stresses and the barrier sometimes to have families come, but it's hard for me to resolve it sometimes. So it's like, Alexa, can you help me try to figure out how we're going to get this family to the health center, And she's really good at staying on top of trying to arrange.
And I go bug Lana and ask her how she does it. And other social workers have been here. Yeah, it's been really great.
Yeah, paperwork to get something funded from NIHB or principals. Great.
Yeah.
So
Yes.
really like intakes, right? If like the other services are not here, like if somebody's not here, but somebody needs like on speech, actually I'm not here.
Yeah, for sure. I try to unless it's a very specific referral and the family's not interested in anything else, even if they're referred for one thing, I'll try to do an intake and sit down with the family and try to get a broad picture. And from there, yeah, we do an intake. Go over lots of questions, and then we usually come together as a team and go over that intake and kind of determine, based on the family's goals and where they want to start, and what they've told us, how we want to proceed. Because sometimes there's kiddos who really could use every single service, but we're not going to have the family come twice a week or whatever is realistic for them. So we kind of have to decide what their goals are, what's most important for the family, and go from there on which therapists they see first, or they do sessions together with different therapists. But yeah, I would say for referrals, or we'll talk about that, or intakes, when in doubt, if you don't know, you think a kiddo could benefit from our supports, but you don't know which therapist or where they fit in, just you can come to me, and I just always start by having a conversation with the family and going from there. So a little bit more about our community programming. So we also provide support at the Head Start program and the daycare. So a screening program is offered by Liza, the physio, our occupational therapist, and our speech language pathologist. And these supports are universal supports, I think.
Yeah,
Is your
Yeah.
I know, you're the one in there.
I just put your name. So we last we only started in January, but we were going to Head Start once a week, and we're just going to start earlier in the fall this year. And we do universal supports for both the morning and the afternoon class. So we try to, for example, we did this bunny briefs thing. So we start with reading a book, and then we try to do a gross motor activity based around the book. So for this, we did some breathing exercises, and then we do a little craft. And Andrea is the craft master. She comes up with all these crafts, and so we do something, and the kids get to cut and glue and do all those sort of fine motor skills. And it's stuff that they're already doing at Head Start, but I think it also just gives the Head Start ladies a bit of a break, too. And it's just different spaces, and it connects them to our services, too. So there's also a similar support at the daycare. So I think we're not really doing universal programming there, but it's a little bit more, I think there's more one-on-one services that are happening with some of those kids, but we can go and offer our services at the daycare, so the family doesn't have to bring their child here.
Yeah. Because usually, or all of, the kids at the daycare, the parents are working full-time.
Yeah, so it's really easy then for parents to...
Yeah, and our team, so like I mentioned before, there is the Stony Education, the Renfrew Stony team, the Renfrew team at the Stony Education School, so at the Nakota Elementary School and the Minifi Community School. They also have psychologists, counselor, occupational therapist, and speech therapist. So we are like separate teams. Like we don't, we're separate within the same company, but in separate, function separately. But we obviously have a lot of kids that overlap, and that we sometimes are both in their circle of care. Or during the school year, a kiddo might be like receiving speech therapy and services from the occupational therapist at school, and then during the summer, if the family sometimes it's like wants more support, they'll bring them here for the summer, and then they'll go back and continue receiving those supports in school. So, yeah.
So referrals, I think I've received referrals from most of you guys. We have, so most of you probably already know, but if you're on the CHR, then you can just do an internal referral to us. There is a form on the CHR that you don't have to use. You could just, if you only have 2 seconds, you could just write, I saw this kiddo, the family consents to you contacting them for speech services. Something like that, if you think that's what they need. And send it to someone on our team. Alexa, if you can think of anybody. And so it can be as simple as that. It doesn't have to be a lot of information because we always do an intake anyway to find out exactly what they need. We get external referrals sometimes from like Children's Hospital or other services if children have moved to the community here. And then families also self-refer. So some families know our program because they've had other kids in the program or they've heard about it, and so they will just call up and put their kid in, which is great.
I'll hand these up too if you ever have a family and they're like thinking about it or want to self-refer. You can also just provide our number and they can just call or text us.
Yeah, and so they don't need a referral from a doctor to access our services.
Probably not.
Much of our team doesn't have access to speech therapy.
Right. Yeah.
So we just have that out.
Yeah, you have that form. Yeah. So. Or you can just call us. Yeah, exactly. Yeah.
So like talk to Alexa over the phone with me.
Yeah, or send us an email if you have our email address.
Doesn't have CHR. If anyone else here doesn't have access to CHR, it's just no.
Our team, so the crisis team and team will see us the only one on our team that does.
Yeah.
But the crisis team has referred. They're not in the CHR?
No, they give us
Just Alicia. So if it's coming from me, it will be the paper.
Oh, okay.
Email.
Okay. Yes, we do have a paper referral form that can be used, but we're pretty easy if you just send an email or call us and just say that the family consented, and you can reach out. I don't think those are main referrals. Yes. Thank you, Ishki, for this presentation. We do have some Shepherd emails, but I don't know, should we take questions?
Yeah, questions first.
I need to restart it.
Is there anything that people learned that they didn't know about our team?
I know you guys can do full psych ed, actually. I wasn't sure about that.
You didn't know that it was high schools.
Yeah.
I thought it was like it was like a clinic offering services.
No, yeah. The service delivery here is different from most of the company.
Yeah. I only work on Nation Seems to Cure, and
Yeah.
I say I feel so pretty separate from that.
Yeah.
Those teams, it's like a whole nother world, but obviously similar, same services and goals, just in a different
Delivery,
setting,
in a different
delivery.
package.
Yeah.
So this is working like regular Jeopardy, but we can just go through. If anybody wants to answer a question, you don't have to, but you can put your hand up and then you can choose which category.
I have candy.
We have candy.
So a yellow category.
Development 100.
All right.
So what means that? 0 to 3, but all of them.
Yes.
Yeah.
Woohoo!
The first
Few years. Big.
Big.
There are many little spurts of brain development. That's cool.
I was going to throw it at you, but there you go.
Anybody?
How about the E500?
Oh, gee. Whoa, going for the big one.
So 160, 160, 4 and is it the main thing is 160 and then the other one is
The big room is 160.
yeah.
I think it's like that's something better.
Yeah. You can just stand in the hallway and go, yeah.
It's like 169.
Yeah.
Wow.
I find everybody on this now.
That was just a million number. Yeah, just walk around until you find someone you recognize.
Oh my god.
Oh my gosh.
Pick again, right?
Both teams were 100.
All right.
What ages? It's a range.
Does he have a time frame? Zero to get press our button.
0 to 18.
Yeah.
Had it.
He's a very unstructured kid. Yeah.
Because
What do you mean we're supposed to shout out if you want?
Oh, anybody?
oh yeah, you should.
Oh, sorry, that wasn't clear. Just
Yeah. It's not.
I was like this.
just yell.
Yeah.
Just yell. Okay, well now that we're close.
Well, I don't know.
62 8.
Referrals for 300. This is tricky.
Is it the OT?
Yes.
Andrea.
I only know that because my own kid.
That sounds like a conversation I'd have.
It's a conversation I have every single
I know.
referrals for 100.
One and done.
Alexa.
Sounds like you would answer first. What time is that again? Oh, pretty good.
Come on, Brandon.
Preference.
Referrals 200.
Oh.
Liza. Oh, Liza.
That's why I was like, mention.
Yes.
Yeah.
She pointed that out, didn't she?
We don't refer to Liza at all. But
Never.
Yeah. No, forget.
Okay, anybody else?
Is development 500.
Oh wow, good question. Oh.
This is the one with the real answer.
Oh.
Give us your best.
It grows.
It develops.
There are circuitry through all different interactions, whether it's
Narrow pathway.
positive, not positive, tolerable.
Yeah. It's getting bigger, more complex, more connections happening.
Yeah.
Good job, everybody.
Yeah, I think everybody has.
Yeah.
Yes, circuits are refined through pruning.
Yeah.
That's exactly what I was going to say. Yeah. Good. More candy?
Yeah, so actually that's a good comment. I don't think I
It's
really,
more fun.
I'm probably going to you.
but the more a connection is used, like the stronger it is and the more resistant it is to trying to change it later, right? So you can think that in positive situations, a lot of these positive things get reinforced, but then also if a child is not lucky enough to be in a positive situation, then there's some other pathways that they're harder to change as they get older, right? Yes.
About the team 300.
We're counselors right in there.
What candy?
Who wants candy? Shay wants some candy.
But referrals 400.
Okay.
Grab more if you want, everyone.
Yeah.
Wow.
Referrals for 5.
Yeah. Or
I don't think
hold on a trial or
I have a
form.
question.
Yeah.
Is the CHR just for specific person or is it a whole group?
Yeah,
you
let you
can't-
select.
Yeah, you can't select multiple people in a referral.
Unless
So-
we are though, if you do an outgoing referral,
Yeah, but
there
like,
is
we're not
the
gonna do
whole
that.
team.
Yeah, because then it sends a fax and the fax gets printed and they take it to our office.
In sense of that.
Yeah.
I think I've done referral to you like that through the CHR. But I don't know if there was like if you guys have a group like in
I think they don't. It comes like a referral, Renfrew.
Not anything internal for some
Not
reason.
internal, it's individuals.
It's only
Yeah.
individual. But we are a group outgoing, but I think
Because I think the way the CHR is set up, it's like everybody has an individual mailbox. So there's no like Renfrew mailbox, just like you guys don't have like a big
I'm gonna try it because I'm
mailbox.
pretty sure I saw
Well, there is. If you do an external referral, you can see Renfrew Services.
internal. I've seen
No,
it because when I will try and then we can figure it.
Yeah. The external one, if you go in forms and you find the Renfrew referral form and you fill that out, and then you see who you're gonna send it to, it's automatically assuming that you're doing an external one, so you choose Renfrew. It's fine, it'll get to us, but what tends to happen is it gets printed by admin and then they bring it to our office. So it just seems like a couple extra steps we don't need, you know?
Yeah, for sure.
I
I think I've
that's
seen it in
what happened.
message.
Yeah.
Yeah.
The
and-
messages are the ones that have the
Oh, yeah. You can select, or you can select like.
Or just internal referral, if you go referral internal, and then you choose one of us.
I have a
And-
question.
Okay, to us.
You mentioned culturally safe. Why, like, I know confidentiality is a biggie here, but how do you incorporate culture into a system? Like, an example I'll use is a mother had a baby while she was doing drugs. She wanted to know, she was thinking about talking to the team. She wanted to know if she had did damage to the baby, the brain. But she also wanted to incorporate the cultural practices such as smudging into the session. But I told her I wasn't sure if the team would allow that. So how do you, like, how is culture involved in Renfrew's team?
I'll say for example, for our speech team, like a lot of times in our intakes we ask what languages are spoken in the home, and if they're like if they speak Stony in the home and they want to do sessions in Stony, obviously our speech therapists don't speak Stony, but what they can do is they, like, a lot of times if they have little kids and they have visuals, they'll ask families like if they're making visuals or like maybe like a schedule for the day. They'll ask the family like what word to use for this.
And the schedules are like literally these like physical little pictures, you know. If some kids have trouble comprehending words, they use pictures, so they'll
Yeah.
Stony words on
Yeah.
the picture.
So they will definitely like even though our team is not speaking Stony, they'll ask the family like how would you like to incorporate it and do their best that way, and also the parents in the session. But like you said about the smudging, like we definitely are open to anything like that in our sessions. We'd probably come to you and be like, oh, this mom wants to smudge during session. And we're
'cause,
definitely
you
happy.
mentioned family support here. Most of the families, the mothers, they don't have the money there to obtain or purchase and what they need to give to ceremony. So if a mother mentioned that, would you be able to assist with that, or is it a program like?
Assist with obtaining like smudging.
No, assist with purchasing.
Financially.
Oh,
I would consider like a Jordan's Principle application if it was for like a session with the child. Like you could do a Jordan's Principle application.
No, Jordan's Principle takes a while for the process, the application.
Yeah.
I'm talking about if they wanted to go into ceremony tomorrow,
and then they need to get.
but they need the blankets and the cloth and the ribbons to present at the ceremony.
Yeah.
Who, like, you said that there's family support there for finance or something there. Would you be,
Come to me.
I was gonna say
Go to the Family Resource Network.
Yeah, I feel like the family resource thing, I like, that's where I am usually working with my colleagues. I'd probably be asking you, I'd be asking Laura, and I think Laura, you
We
have.
would try and like work that out between the resource network. So if we can't get it, it's a need. It's something that we're trying to fill in that moment. Like we'll band-aid it, and then knowing that it's a need, we'll try and make sure we have something.
because I remember this new mom.
Yeah.
She wanted to go to ceremony with her baby, but she also told me that
Not to worry
she
about
didn't have the money to purchase the
Okay.
stuff for the ceremony.
Yeah.
I told her I could refer her to GFO, but she also wanted to see if she can get her baby into Renfrew.
Yeah.
Sure.
And if there's something that the family is needing, like to feel safe, that we can't offer in here in house either, like we can always go to their home as well if that's a safer environment for them. That might feel like then they could do some smudging or something there. We're always happy to go into their home as well.
Yeah.
And I think for myself, trying to be culturally sensitive involves talking to the parents about what their goals are and what they want, right? So in my training as a physio, I have these things like this should happen, this, like all these things that you learn at school, the way things should be happening, basically, but it's different. So checking in with the family to see what they want, knowing that everybody's different. I think providing that space for like really asking the family what their goals are with that and what's important to them.
Thank you.
Yeah, you can always send it to me, and the thing is, even if I don't have the answer, it's my job to figure it out. So that's where I will problem solve, and I will be talking to FRMA, and I'll be talking to the Stony social workers. So, yeah, please don't hesitate to send them our way. Yeah, that's where I rely on
Yeah.
Stony Health Center as a team to collaborate. Yeah.
Okay, bye. Thank you for coming.
Yeah. Do we want to? What time is it? How are people
We
feeling?
can just go over them. If you want, or we could just stop.
What kind of stress?
Oh.
Bring toxic.
Toxic stress.
Power through and then.
Oh, expressive and receptive language.
Wow.
Wow. Positive experiences in caregiver child interactions is not servant.
It's like all I can think about was serving for pets. Justice Major and me.
Better brains.
Yeah, better brains.
I thought that after
Dry
was brains to actually my hand. Last one. What came for us?
All of us.
Oh,
Yeah.
Yeah, Head Start.
Head Start, daycare, yeah. Programs for the high school too. And
I don't have, obviously, all of you guys might
We should get the Alex family to come in and do like their brain story.
I would love that.
And get Nancy into it because she would.
These are going to be forever.
Brain story? Yeah.
It's the first
It's a little shorter now.
Yeah. Oh, is it?
Yeah, because it used to be like 37 hours or something. Now
I think it's 20 hours.
Yeah, it's
Really?
Yeah.
I did
It took me a year to do it.
But Palex will do like they do these seminars. They're awesome, and they take the afternoon and they go through like the fulcrum, not the whole brain stories, but specifically how
I think it's just really love understanding, like, yeah.
Yeah. Anyone, any last questions before I wrap up? Thank you so much. Thanks for coming.
Thank you very much, lady.